Well, good morning again, everyone. I am so grateful that you've joined us today. We're here as part of something really special, Forum for the Future, which is a coalition of coalitions and members dedicated to building a state of the art early childhood system in Mississippi. Whether you're representing families, health systems, early care, advocacy, research, or community groups, you belong here. Together, we're building something bold, something urgent, and something lasting for Mississippi's youngest children and their families. Next slide. Okay, so our agenda for the day, before I continue to talk about Form for the Future, I want to give a second to give you the agenda for today. I'm going to tell you more about Form for the Future, which is about our common agenda. And then we're going to have a presentation today from Mississippi Low Income Initiative, Mr. Matt Williams. And the topic today is TANF, Key Trends, Policy Opportunities, and Implications for Families. So we thank him and his representatives, and I know I see some people that work with him online as well. So we thank you all for joining us. And go to the next slide, Mindy. So I'm going to tell you a little bit about Forum for the Future. Like I mentioned earlier, it is a coalition of coalition and members. And as of this morning, we are 289 individual members and growing. We did a presentation about 2 weeks ago. We were at 230. And so we appreciate the membership. We want you all to keep spreading the word so that we can continue to share what's happening in our state. Our approach is rooted in collective impact. That means we aren't just talking, we're working, aligning our efforts, and making spaces for new voices. We commit to some bold operating norms, including owning the work together, trusting the process, dismantling inequities and overcoming mistrust, leaning into discomfort and each other, choosing learning over perfection, and persisting even when the work is hard or incomplete. This isn't performative. These are real guiding commitments for how we collaborate. And at every meeting and milestone, we come back to our core principles, and you'll hear them often. Show up fully. This work belongs to all of us. Be open to discomfort. Growth happens here. Prioritize learning. Mistakes are okay. Relationships matter more. And last, stay the course. We are in this for the long haul. So, how did we get here? This all started because of a shared belief. Mississippi's children deserve a better system, and no single person or organization can build it alone. So in early 2023, in late 2023, 2024, we came together across coalitions to imagine a new path forward. And over the past months, we've had work groups, conversations, and webinars to align on policies like paid family leave and early intervention, share power and center equity, map gaps in care and infrastructure, and build trust across silos. So we're not just imagining the future, we're building it together. So here's where we are in the process. As you can see, the timeline is on your screen. And this has been a very long process, but we're glad that we are at the moment where our priorities have been voted on and we're now able to move forward. And we do have an amazing event coming up at the closer to the end of this month that we're going to talk about in a few slides. So next slide, Mindy. All of our work falls under three main strategic priorities, and these were shaped through community conversations, work group, and member input. The first one is state of the art early care and education, and you can go to the next slide, Mindy. One more. Okay, so this shows you what falls under that priority. The system is supported by sustained resources and investment, improved health and academic outcomes, increased access to affordable child care, and child care is a stable, competitive, and respected field. The second priority, which was voted on this past summer, is strong families. And as you can see there, it is a responsive, family driven system of care for young children, equitable access to paid family and medical leave, child welfare practices, child welfare practices work for babies, and families are economically secure. And in the next slide, it gives you a breakdown of what we mean. So I'm going to leave that there for a second so that you can see the examples of what we mean when we say those things that fall within those priorities. All right. Okay, and then the next one we have healthy mothers and children, and this one is pretty big, and we're excited about this one. But we want mothers and children to have access to comprehensive, high quality health care from conception, access in affordable, healthy, and nutritious food. Young children live in healthy, safe environments. A supported, compensated, and qualified healthcare workforce. Timely, high quality, and responsive mental health care, and timely, high quality, and responsive access to early intervention services. And again, like we did with the strong families, these next slide give you an example of what we can expect to see when we think about these priorities as well. Okay. And through all of this, what we really are looking for is a coordinated, efficient system, which states Mississippi has a functional, family friendly early childhood system supported by an efficient and coordinated infrastructure for children and families at both state and local levels. Next slide. All right. Again, like I mentioned before, we are at 289 members. We thank our members for everything that they have done, attending different listening sessions, our steering committee for the work that they did throughout the spring and the summer. And if you are not yet a member and you feel the need to join, membership is free. And we want everyone that's interested in helping infants, toddlers, and their families thrive to join us in raising our voices. And you can learn more, and we need to change this email address. Is it changed yet, Mindy? I'm sorry. The website.
The website's still accessible as Mississippi, msforumforthefuture.org, but recently
Okay.
we were given feedback that that might be a little too long. So what I put in our chat is our new redirect, which is mississippifuture.org. I'm also excited to share that we have a launch today happening a little later this afternoon, our Facebook, Instagram, and YouTube for the forum. It will be forum specific content, making sure that you stay up to date with all things Forum for the Future.
Thank you so much.
Thanks.
Next slide. And as we mentioned, we would love for you all to join us at our State of Babies event, which will be October 22nd at the Eagle Ridge Conference Center in Raymond, Mississippi. The time is from 10 a.m. to 3 p.m., where we're going to have an exciting conversations like the one we're getting ready to hear from now and more as it relates to all of our priorities um, that we just discussed a few minutes ago. Well, not all of them, but the priorities that we discussed a few minutes ago. And then we were going to launch our Built for Babies campaign during our State of Babies event. So we have some wonderful things happening with Forum for the Future. And go to the next slide, Mindy. This gives you a little bit of breakdown of State of Babies. And this year's event will spotlight real stories from Mississippi families, celebrate policy wins that support babies and toddlers, and prepare attendees with tools and training to champion change. All right, next. Now I am done. And I hope that you all are as ready as I am to hear from our next speaker. And so I'm going to make sure that we pin him so that you can see him as he prepares to share his slides and share with us information regarding TANF. So I'm going to turn it over to you, Matt. Thank you so much.
Thank you so much, April. And it's great to be here today and with you all. Really looking forward to having this conversation. Again, my name is Matt Williams. I'm Director of Research with an organization called the Mississippi Low Income Child Care Initiative. We have been around since 1998, and our mission is to really improve the state's system of affordable child care, to increase access, to increase retention, to increase revenue in that system, to address issues that providers are experiencing, serving parents who are being served through childcare subsidies in that system. That's a main part of our work. And we also work on strategies and through direct service demonstration projects that try to make labor market outcomes more equitable for single moms in Mississippi. And we also work on a range of public assistance policy issues that affect single moms and young kids. And so that is a sort of high level overview of what we do as an organization. and some of my colleagues are here today. Our executive director, I think Carol, I saw Roberta Avila, I saw, and I believe I saw Sally, our policy analyst. Thanks for being on. If I missed anyone on our team, I'm sorry. And please, to the folks on my team, speak up if I'm getting anything wrong. So I am going to share my slides. And, one thing I want to say at the outset of this is I did my best to keep this as high level as I possibly could. But probably no surprise to anyone that when we start digging into temporary assistance for needy families rules and regulations and what we're able to do for childcare, some of that gets a little wonky and a little bit into the weeds. But I want to let you all know that I have kept it as high level as possible. But please get ready to ask any questions at the end, and I'm happy to go through any of this. So the name of this presentation is Blend and Spend. Do temporary assistance for needy families rules allow Mississippi the flexibility to increase access to affordable child care? And that's really the research question and the policy question that we took on as we started to look at issues related to child care revenue. And I'm going to get a little bit more into that. But first, what I wanted to do is kind of set the table and share with you all how we at the Child Care Initiative look at families in the state of Mississippi and how we look at children and just sort of what we see when we look at the landscape. And when we look at families and when we kind of narrow those families down to even sort of just those who are headed by a householder who is living with their own children, what we see here is in this blue part of this pie, these are married couple families. That smaller gray section of this pie, these are families that are headed by a male householder where no spouse is present. And this substantial orange portion of the pie are families headed by female householders where no spouse is present. And this portion of families in Mississippi are headed primarily by single moms. And when we look at that another way, and we look at children below the age of 18, we also see, again, a really large proportion of children statewide, based on some estimates, up to more than 40% of children under 18 living in families where the householder is a female with no spouse present. Again, what we refer to in our work as single moms. And even when we narrow that age group down to children below 6, we see again a huge portion of children below 6 years old in our state are living in single mom families. And so I share this data not so much to leave you with specific statistics, but to kind of get you to see how, when we look at families in this sort of pie, a really large portion of that pie are headed by single moms. A really large number of kids in our state are in families headed by single moms. And so what we know is that issues that impact single moms, particularly childcare affordability and access, are not just impacting a small subset of our state population. They're impacting a huge subset of our state population. And that's one of the things I wanted to kind of say at the onset of this. We know, based on some federal HHS guidance, that affordable childcare is 7% of income. I believe that's gross income. And when we look at median income by family type, and what I have here in this chart is sort of the family types that census data make available. And in this first group, you can see that's all families. The second group, married couple families. This third group are single mom headed families. And this fourth group are single dad headed families. And what we plotted in this blue bar is median income based on that family type. And in that gray bar that you kind of see behind there That is what poverty level income would be for a family of two. So let's say a single parent and one child. That's what poverty looks like. And in that orange column, what we did is took an annual child care cost estimate, and we looked at that as a percentage of median income of these various family types. And what I notice is something that's very lopsided here. And that is when you look at that third set of columns, families headed by single moms, you see that median income is much lower than overall family income and then income in other types of families. You see the median income for single mom headed families is like 29,000 annually. And when we look at childcare costs as a percentage of that median income, you can see for a single mom, childcare costs can be for one infant 23% of income. So you can imagine one infant and one toddler can quickly get to nearly half the income that a single mom family is earning on average. And so what we know is that childcare is least affordable for single mom families in Mississippi. And so this leads to, why is that? Is that because single moms aren't working? Well, no, that's definitely not the case. Because when we look at women in Mississippi ages 20 to 64 who have their own children below the age of 6, we see almost 75% of those moms are participating in the labor force. And so what we know is that moms are overwhelmingly and overrepresented in low wage work. And we address that issue through a number of strategies at the Child Care Initiative. But one of the things I really want to focus on today with you all is why we need more access to affordable childcare, and specifically childcare subsidies that make childcare affordable for those single moms who are heading families and also working in jobs that don't pay enough to help them afford childcare. And so I know I don't need to tell this group the benefits of more affordable childcare, but just to go over some of how we looked at this, we see tons of economic benefits when we put more funding into childcare, when more parents have more access to childcare. And again, parents and single moms make up a significant segment of the labor force, and they are better supported and more economically secure when they have childcare options, and particularly when childcare is affordable. We have seen in some studies, one from 2016 that actually looked at the relationship between increased childcare subsidy spending and maternal employment and labor force participation. And what that study found was actually there's this positive relationship in which increased childcare subsidies results in an increase in maternal labor force participation. We also have seen a lot of studies that talk about tax revenue collected with increased employment because more parents are able to work with more childcare and with affordable childcare. And that means there are employer benefits to having that childcare access stable and available. There's reduced turnover among employees. There's fewer disruptions. There's higher productivity. We know, and we have studied in some of our own programs and with partner programs, that there's increased retention and increased completion and graduation rates when workforce training and education participants have access to childcare. And so we've also seen these big macroeconomic studies that look at how much economic activity is generated for every dollar invested in childcare. And some studies find that there's at least $3 to $4 in cost savings for every dollar invested in childcare. Another recent study found that over the lifetime of sort of the benefits of investing in high quality childcare and early learning programs, as much as $7.30 could be generated for every dollar invested. So we know childcare yields a huge return, but it also gives us the opportunity to support parents and single moms earning while we also support their children learning. And that's a big part of also the benefit of childcare. Young children gain access to ECE through childcare centers that provide high quality services, and that alleviates resource deprivation in families with young children. And this really, at the end of the day, helps lift families out of poverty. So there's this societal benefit. So that brings me to what our primary affordable childcare system is in Mississippi. And for those of you, again, a lot of this information I know is well known by many of you. But when we look at our state system, we have a program called the Child Care Payment Program. And that's really our state's primary subsidy system. And it allows parents a choice of provider. It allows a parent to apply for and receive a voucher that they take to the provider of their choice. That could be a private child care center that is participating as an eligible provider in this program, and it could be other kinds of child care centers. The voucher covers child care costs on a sliding fee scale that actually sets a parent copay, and that copay is based on a family's income and the size of the family. The important thing about the child care payment program that we like to emphasize is that it supports full day, full time, and full year child care services. And so when we are working with working moms, working parents, we know that they need child care that is more than 6 hours a day, child care that is open during the summer. They need child care to be that stable support system that supports and coincides with work schedules. We know that child care centers now in Mississippi are mandated to participate in quality improvement activities, and the new quality support systems being rolled out now. And child care providers in this CCPP program are also licensed, or they're registered with the State Department of Health. There is a strict work and education requirement for parents applying for a child care subsidy. Parents have to be working 25 or more hours per week. They have to be enrolled in training or education full time based on that institution's definition of full time, and that educational institution has to be accredited by the state of Mississippi. So there are some pretty rigid requirements. But once parents get this child care subsidy, it makes a huge positive difference in their life. Currently, the child care payment program is funded by a block grant, a federal block grant called the Child Care and Development Block Grant. The program is designed to be compliant with that federal block grant. And some other federal funding streams are also combined, and together those are called the Child Care and Development Fund. And I'll refer to this throughout this presentation, and it's called CCDF. And so currently the Child Care Payment Program is primarily funded with CCDF, also a recent general fund appropriation from the state, and also a transfer of TANF funds, which I'll get into more here in a second. So the good news is that Mississippi's Child Care Payment Program has been trending in a great direction the last few years. Some great policies were changed, and also the state used funds it received during ARPA and during COVID to increase the number of kids served and to meet that need, because there is such a huge need for affordable childcare. And so this is some data from state annual reports for the last few years. And you can see from 2020 to 2024, we went from serving around 30,000 to more than 40,000. So a huge increase the last couple of years, which has been great. The sort of downside that I have to report to that is there are many more children throughout the state living in families who are income eligible for these child care subsidies, but who are not served due to the limitations in funding. And current estimates are that there are about 140,000 kids eligible for federal child care subsidies throughout the state. And the income eligibility, I should say, for the child care payment program is much higher than other assistance programs. It's 85% of state median income, which translates to about 175% to 200% of the federal poverty level. That kind of compares to, let's say, the SNAP program, where the income eligibility is 130% of the federal poverty level. And so for a family of three, a parent and two young kids, that parent could be earning up to 47 or almost 48,000 and still be eligible. So how can we increase access to these affordable child care subsidies in Mississippi? Unfortunately, due to a funding gap in post-COVID relief funds, the state of Mississippi announced that at least 9,000 children will lose access to federal child care subsidies in 2025. And I have to, and I should say that this has likely already occurred. We believe that many of you on the call may be providers who have been directly impacted by the pause in applications following a funding shortfall that started April 1st, 2025. We think that this at least 9,000 kids, maybe more at this point, have lost access to assistance. We do have, our organization did send out a survey. Some of you may have taken that survey, and we are in the process currently of analyzing those survey results, and we hope to put a report out soon and have some more information to report to you about the impact on child care providers, the impact on parents, and what this pause has actually looked like for parents and providers. And we hope to have that out very soon. But we know that in Mississippi, before April 2025, we did not have a waiting list for child care subsidies, and we were in a great sort of flow with that program. And unfortunately, now that waiting list is increasing by the thousands. And so what that makes clear is that there is this continued high demand for affordable childcare among working parents. And so that brings me to this ultimate point. We at MLICCI are very focused on increasing revenue for child care subsidies. So what does that subsidy revenue look right now? You remember earlier I mentioned the primary funding stream for subsidies in Mississippi is called CCDF. So what that allocation looks like in the post-ARPA supplemental funding world is about $138.2 million in federal funds. Remember that 12% of funds have to be spent on quality improvement activities, and that's a federal requirement. The other portions that are sort of added to that CCDF pot are a 30% transfer of current year federal TANF block grant dollars. And in the most recent year, that looked like $25.9 million that was transferred directly from TANF to CCDF. And that 30% transfer, while that is the maximum a state is allowed to transfer from current year TANF block grant funds right to the CCDF block grant, which the funds become CCDF discretionary funds, while that is the maximum, it is not the maximum for how much a state can spend directly from TANF on child care. And I'll get to that point a little bit more. We also put some state funding that is required for matching requirements for drawing down the full amount of our CCDF block grant. And as I mentioned previously, in 2025, the state legislature for the first time appropriated $15 million in state dollars, state general fund dollars, to the child care payment program for child care subsidies specifically. And we understand from the Department of Human Services that that $15 million is potentially going to serve up to 1,850 children who are on the waiting list. So where we're at with the revenue goal is that after the state reported this shortfall, after temporary ARPA money expended, the budget request the Department of Human Services was making was around $50 million to sustain the reach of the program pre-April 2025. Based on some public comments that have been made by agency officials, based on that $15 million that we know was appropriated in this previous session, we are looking at about $35 million to $50 million as a sort of revenue goal that we are advocating for and really working to identify what revenue we can bring to the table to enhance and expand the reach of CCPP. that brings me back to the TANF program. And I enjoy talking about TANF. I don't know how the rest of the folks on this call feel, but I am going to ask you to kind of go with me into some specifics here. And again, I'm happy to pause at any point for clarification or answer questions at the end. So TANF is another block grant that the state receives. And TANF, just for historical purposes, replaced a program called Aid to Families with Dependent Children, AFDC. And the big, I think, structural shift that we all need to understand when we're talking about block grants is previously sort of what we thought as quote unquote welfare, cash assistance, was structured under AFDC as an entitlement program. And so if you were eligible and living in this country, you were entitled to receive that assistance. And so states designed programs and were funded at a level to make that happen. In 1996, under welfare reform policies, TANF was created and AFDC was restructured to be a block grant. And so in the block grant structure, a couple things. One is the funding amount was capped in 1996 when TANF was made into law, and the funding doesn't increase. It doesn't increase with inflation, and so it stays at that same rate. And the big thing I think to understand with TANF is there are 4 really broad purposes of TANF. And states, for the most part, while there are some federal guardrails and federal rules that apply to some instances of state TANF spending, states are given in reality a really wide range of discretion on how they can use their TANF funds, so long as that use of funds falls under one of these 4 broad purposes. And I have them here on the screen for you. And there's so much to say about TANF and that can be said about TANF that I'm not going to be able to get to in this presentation, but I want to draw your attention to TANF purpose number 2, which is ending the dependence of needy parents on government benefits by promoting job preparation, work, and marriage. And I bolded those words, promoting job preparation and work, because that's how we get to childcare as an allowable TANF activity or service. Because childcare, I think more than anything, supports job preparation and work. And even though historically a wide array of activities have been undertaken by states under these 4 broad purposes, many states use TANF funds for childcare. So it's a common use of TANF funds, and it's considered really widely by policy experts and researchers to be one of the best uses of TANF funds. So this sort of gets to, do TANF rules allow us to expand access to child care, and specifically to affordable child care through our existing child care payment program? And so we did a lot of research on this, and we've had a recommendation on this for quite some time. But there are really 2 ways states can use TANF money for child care assistance and specifically for subsidies. And one is that transfer I mentioned earlier. States are allowed to transfer up to 30% of current year TANF funds to CCDF. And the great news is our State Department of Human Services is already doing this, and that is a wonderful thing, and we applaud them for doing that. And again, as I mentioned previously, that amount is about 25.9 million, I believe, is the figure in the slide that was in the slide. So it's a significant amount. And that's something that we are certainly advocating for our state to continue to do as a practice each year. The other option that states have to use TANF for childcare subsidies is through what's called, in the TANF regulatory framework, TANF direct spending. And I think it's important here to say, in the TANF world, I think it's helpful for all of us to distinguish between what we mean by assistance and what we mean by non-assistance, because these are kind of, these words I think they can be very confusing. Assistance often means that a person is receiving cash assistance through TANF. And that is one use of TANF funds, and we certainly support more parents receiving cash assistance through TANF. But the reality is that very few receive cash assistance through TANF currently. And when we look at our current TANF block grant, most of the spending that the state is undertaking really falls under this category of non-assistance, which means it's assistance, it's a TANF service and an activity that's totally allowable, that's helping low-income parents achieve one of those four purposes of TANF, but it's not tied to cash assistance. And what that means is there are different eligibility requirements. And I'll get a little bit more into that in the slides, but just to make clear that what we are doing as a state currently is this transfer from TANF to CCDF. What we are not doing with TANF, that is another option, is instead of transferring money from TANF to CCDF, spending funds directly out of TANF on childcare, which is, again, another allowable expense. And just to go through some of the numbers here, this is a recent expenditure report, and you can see here that we are not spending TANF currently on direct spending, and you see that child care assistance and non-assistance category there. We are not utilizing that option. However, if you look down at this second chart, you will see the 25.9 million transfer from TANF to CCDF. And you also might note that last line at the very bottom that says unobligated balance. And that's referring to TANF funds that have accrued over the years, because the reality is states are not required to spend all their TANF funds each fiscal year. And so they can carry over those TANF funds. And there's not a spending deadline on liquidating those TANF funds. And so states often do build up TANF funds over the years that go unexpended. And that money can essentially remain in that status in an evergreen way. So when we really looked at, okay, we're in this child care subsidy crisis, we know we have thousands of kids that are losing access, thousands of parents who are losing access to care. How can we get more revenue into this child care payment program system? So this is sort of where we landed after studying models in other states and after studying what is allowed under federal TANF regulations. And so our recommendation is that the child care payment program be treated as like the delivery system, and it is the primary delivery system for child care in Mississippi. It serves a lot of children. And if we look at CCPP as like the bucket where we're trying to pull as much revenue as we can envision a policy framework in which we continue to do what we're doing with CCDF, and that is the primary funding mechanism for our child care payment program. We continue to transfer that 30% of TANF to CCDF discretionary funds, and concurrent with that, and in addition to that, we also utilize this option to spend TANF funds directly on CCPP subsidies. And the good thing about that is that TANF direct spending can come from either current year TANF funds and carryover funds. And so in this kind of model, the parent's experience is not changing based on the funding stream. What happens internally are processes, and I'll get to this here in a second, but there are internal processes that are put in place on the administrative side that don't affect the experience for parents. And so when we looked at other states, we looked at Ohio. Ohio has a child care subsidy system they call the Public Funded Child Care Program, or PFCC. And that serves as a really great model, because what they do in Ohio is they bring in state appropriated dollars, they bring in their CCDF block grant, and they allocate a pretty large portion of their TANF funds, whether they're carryover unexpended funds or current year funds, directly to their subsidy program. And the difference is they report on CCDF funds as CCDF expenditures to the appropriate federal agency, and then they report on TANF direct funds to the appropriate TANF agency as TANF child care assistance that would be technically considered child care non-assistance because it is for an employed parent. And that is a requirement in TANF regulations. And it's very possible. And when we look across states, 16 states are both transferring TANF to CCDF and spending TANF funds directly on child care concurrently. So it's not like this is something that no states are doing. It's a pretty common thing. And another really helpful recent example is Texas just recently ran into an issue where they were trying to bring more revenue into their child care subsidy system that they call, that is run by their workforce development agency. They call child care subsidies scholarships in Texas. And what they ended up doing was taking $100 million in unexpended TANF carryover money and put that into their CCDF program as TANF direct spending. So these are two recent state examples that we think could serve as a good model to look at and to replicate as we move forward and trying to figure out how we're going to bring more revenue into the CCPP program. Now, I have a couple more slides here, and this is kind of where I get into some of the policy weeds on how we could align TANF non-assistance direct child care spending with rules existing in the child care payment program and sort of how we could get this done from the policy perspective. And so first, it's I think, again, really important to point out that TANF funds can be spent on any allowable TANF activity or service. And so childcare is an allowable service. And the reality is states are not limited in how much TANF funding they can use for childcare. They are not limited. Even though there is a limit on how much current year block grant funds you can transfer right to CCDF, a state is actually allowed to spend as much TANF money as it wants to on childcare if it is spending a portion of that funding on TANF direct childcare assistance or all of that funding on TANF direct childcare assistance. So childcare assistance versus non-assistance. Again, this is getting into some wonky terms, but states can spend TANF funds, again, directly on childcare for working parents that are eligible for our existing childcare payment program if we, through a sort of regulatory framework, treat these parents as TANF participants receiving non-financial childcare assistance through the state CCPP program. And so what this means is that a CCPP participant would also be considered a TANF participant receiving childcare non-assistance. When we compare the income eligibility between the existing CCPP program with the non-financial assistance income eligibility that's laid out in our TANF state plan, what we see is that our CCPP program establishes 85% of state median income as that eligibility threshold, and that translates to about 175 to 200% of the federal poverty level. Now, Mississippi, you may not know this, but in Mississippi's TANF state plan, Mississippi allows TANF spending on non-financial assistance for participants earning up to 350% of the federal poverty level. So a family receiving CCPP right now today would be considered quote unquote needy under this definition of non-financial assistance income criteria the state currently sets. So when we look at what states did to implement this model, what we see is that TANF direct spending, the way it works is a state will allocate a portion of their TANF block grant for direct spending to the division that handles child care subsidy payments. And that's typically conducted internally in states using this approach. Some states have state law that dictates what has to be done with TANF money. We are not in one of those states right now. It is essentially up to our State Department of Human Services and our governor. What happens from an administrative perspective in states that do this is interdepartmental coordination of federal reporting requirements. And so that is to say, there are internal sort of coordinating efforts that assign sort of reporting. For instance, expenditures on TANF childcare non-assistance CCPP subsidies would be reported by the state agency as a federal TANF expenditure to the appropriate federal TANF agency. And the participation in that program would be reported to the federal TANF agency versus CCDF expenditures would be reported as a CCDF expenditure to that appropriate CCDF agency. So it's really just a matter of blending these two federal funding streams and internally coordinating the reporting and the tracking of the revenue and the participation internally in this blended model. But the experience for parents doesn't change in states that implement this practice. They're just receiving a child care subsidy. They don't know whether it's funded by CCDF or TANF direct spending. You remember that the chart I shared earlier that showed rather high accumulated balance of unspent TANF funds. This is what that looks like over the years. You can see about 10 years ago, that number was about 35 to 45 million. A lot of TANF funds were spent down around 2018. There's a lot going on with the state TANF program around that time, for those of you who know all that. That's a whole other subject, though. And what you can see, though, in the last few years is that these funds have accumulated. And so this is one of the reasons we had initially looked at this as a potential revenue source for CCPP. What I can tell you as of today is that the Department of Human Services released, after the April 2025 pause in subsidies, a workforce support subgrant RFP. And the RFPs are now closed. I want to say that. And I'm certainly not representing any sort of information specific to any application process or anything like that. However, I want to make clear that those RFPs are closed at this point, at least the ones that were released in response to this sort of after this subsidy funding crisis. And doesn't mean more RFPs won't be released in the future. There may be additional RFPs, but for now, the ones that were open are closed. Childcare, the good news is that childcare is one of 12 support services identified in these RFPs. And this is really MDHS's strategy for utilizing these unexpended TANF funds, offering subgrants that provide support services to eligible entities, which are nonprofits or local governmental entities who are serving eligible participants. While I can't say much about the specifics of what these are going to look like, it may be an opportunity to connect parents and children to childcare in communities where organizations are funded with these subgrants. And as we understand it, the agency is reviewing those applications and will make those announcements of awards later this year. And so we're really in a process of awaiting the rollout of this strategy and the announcement of these subgrants. But what we do understand is that a substantial portion of those unexpended TANF funds are currently dedicated for this strategy. However, we're going to continue exploring federal revenue that can be brought into the child care payment program. We're going to continue looking at TANF current year and carryover funds that may be available at a later point for TANF direct child care non-assistance spending. I know that's a mouthful, but that's what it is. And we're also looking at what workforce development funding streams can build child care in as a work support and how we can promote and support those opportunities. And so I'm going to conclude my presentation there. And this is my contact information. This is our website. And if you're out there and you are working with single moms and you're working with moms that need case management services and help connecting to a job that need childcare. And I will say that while the state did pause the majority of childcare subsidies, there are 6 categories that are still being served by the states. By the state child care payment program. 6 categories remain eligible even under the pause. And when more funding becomes available, the pause will be lifted until that funding is expended. But I will say that, yeah. So I'll end it there. Thank you.
Thank you so much, Matt and Carol. I'm so glad y'all were here and able to share this information. One of the main things that we with Form for the Future want to make sure that we are giving you all information and sharing resources and research with you. And so that was one of our main purposes of giving you all this time to hear what's going on. And again, we want to thank Matt and Carol and the entire MLICCI team for providing us with this information today. And we look forward to seeing you all soon. Hope y'all have a good one.
Thank you.
Thank you. Bye, everybody.
Bye.